We are Group 8, working for the TU Delft in collaboration with LAYCO Medical Devices. We work together with one of the co-founders and her colleague, Camilla. LAYCO Medical Devices was founded in September 2020. Their mission is to improve healthcare accessibility while minimizing environmental impact. They're doing this with their not-for-profit impact model, which isn't about making money, but about making a positive change. Their mission includes reducing health risks for mothers and newborns everywhere. Plus, they work to make things better for the Earth by improving sustainability. To reach these goals, LAYCO developed the Vela, a reusable device for safer deliveries. Research suggests it could lower stillbirths and improve safety for mothers in areas with limited medical resources. Our goal was to receive feedback from gynecologists in Uganda on this product. We visited LAYCO's office in Amsterdam to get ready for our project in Uganda. The key tasks there was to connect with doctors through LinkedIn, to fully understand how the product works, and to test the product out on a mannequin. On the first day after we arrived, we immediately had a conference for gynecologists and obstetricians. This was a great opportunity to make contacts with gynecologists and obstetricians in Uganda. After we acclimatized in Uganda, it was time for the first hospital visits. The differences between the hospitals were significant. For instance, there were large private hospitals, but also hospitals overflowing with patients. Hospital visits brought unexpected encounters, like meeting multiple stakeholders at once. Interviews provided deep insights into the current state of vacuum extraction in Uganda. We kept in contact with the LAYCO office through weekly meetings to keep them informed of the progress in our project. The interviews went smoothly, and many gynecologists were willing to work with us. We got a lot of useful feedback. Most of the feedback looked like this.
My name is Dr. Nabimanya Tracy from Uganda.
Okay. And what do you think about the Vila?
Well, I think the Vila is a good instrument in our childbirth, but the tube is way too short. You know, women are of different sizes, and I think you would have made tubes of different sizes, longer ones and shorter ones according to someone's body. And I like the fact that it is reusable, because if it is reusable, then I guess it should be a little bit cheaper than other instruments that you have to use at once. And I love the fact that I can use the Vila by myself without the help of a midwife or me calling someone to help me out. I think this will be a good instrument in our childbirth.
However, we have also frequently heard of problems with other vacuum extractors. Nonetheless, there is a significant need for a good alternative to cesarean sections.
Hello. Dr. Billy Richard Nduano, gynecologist at Menlo Hospital. I'm here to talk about vacuum extraction, assisted vaginal delivery. In our hospital, we have so many deliveries, approximately around 5,000 deliveries per annum, and so many cesarean sections, and some of them would have been assisted vaginal delivery. But currently, we are faced with a challenge. We are using the old Ventus system, which is cumbersome. We require a minimum of around 3 people to handle this. Someone has to pump, someone has to pull, and do the actual, so it's very cumbersome. And I think we need to improve the training. With that one, requires lots of training of how to calibrate the pressures and how to do the actual vacuum extraction. So I think the problem with it comes with initially the training. People who don't know how to use it, who are not comfortable with it, and even the other negatives which are talked about is that how it injures the baby's head and everything. It has hampered or it has delayed or affected its use. So currently, so many gynecologists prefer to just do a straight-away cesarean section than doing the actual assisted vaginal delivery. So we end up having so many cesarean section rate is quite high in this country, and especially in this hospital. And I believe that some of them would have been assisted vaginal delivery. So the current, I think there's need to revamp the old system and have a new system, which is a hybrid of the Kiwi, the Ventus, easy to use, one person to use it. I think it's most welcome. Thank you.
When our boss, Duvertje and Camilla arrived in January, we started a new part of the project. Before they came, we prepared ourselves to make their time as productive as possible. During this time, we started the simulation trials for disassembly and assembly. This gave us new insights into how the different parts of the vela are attached and detached by the midwives, and how fast they learn how to use the product.
And now you can pull up. Yes!
In summary, our project with LAYCO Medical Devices in Uganda was successful. We improved healthcare by conducting an early market investigation before implementing the vela device. The vela device helps ensure safe childbirth. We met several doctors and learned a lot about how the vela can fit into their healthcare system. The feedback we received was very helpful in improving the vela. Additionally, we conducted tests to evaluate the ease of use of the vela. This project demonstrated how the vela can be improved and what kind of impact it will have when implemented. It is a significant step forward in making healthcare better and safer.